Good morning, everybody. I think we're going to make a start. We're a little bit late starting. You're all very welcome, thank you. Welcome to the 4th consortium meeting of the KORALE partners and also the Older People's Council Conference. We want to extend a special thanks to the Older People's Council because they've actually postponed their conference from May to now in order to, to combine today's event. So we're really, really appreciative to the Older People's Council for doing that, and we're delighted that so many are here today. It's absolutely fantastic to see a full room. In a moment, we're going to hear from Eleanor Hull, who is the chairperson of the Older People's Council. And then we will call upon our Mayor of Fingal, Councillor Tom O'Leary, to formally open the event today. Eleanor is going to say a few words from the Older People's Council. Thank you.
Thank you. Thank you very much. Good morning, everybody. I'm going to keep this short. Welcome to you all. I hope you enjoy our conference, and a special welcome to the members of KORALE and to our Mayor, Councillor Tom O'Leary. Thank you very much. Have a lovely day.
Now I'd like to call on our Mayor of Fingal, Councillor Tom O'Leary.
Hello everybody, I'm delighted to be here. I was downstairs at the exhibition where I met many friends from Skerries and Balbriggan and all over Europe. I met them last night, and there's a great buzz here, a great positive buzz, and I look forward to making great progress. Anyway, I'll go into the speech. You're in a lovely area in Malahide, and the last time I was here and getting flashbacks, it was COVID time, and we devised the Fingal development plan in this room because we needed a bigger room where we could socially distance. We had to leave the council chamber. Anyway, we had some very interesting meetings and some very nice food here, so I hope you enjoy your lunch. Anyway, good morning. It's an honour to welcome you all here today to this important conference hosted by Fingal Older People's Council and held in partnership with our KORALE EU project partners who have joined us from across Europe. We are proud to be part of the KORALE project, which focuses on identifying and sharing successful ways to combat loneliness, a challenge that affects us all. Here in Fingal, we have a strong and growing older population, which is expected to rise significantly over the coming decade. While many of our older people remain live and active, connected lives, we know that loneliness and social isolation remain serious concerns, particularly in rural areas, for those living alone or those facing health and mobility challenges. That's why today's conference is so important. It is, first and foremost, our Older People's Council event, shaped by and for older people in Fingal, to explore practical, community-based responses to loneliness. We are proud to place older voices at the heart of the conversation. We are also honoured to welcome our KORALE partners from Spain, Denmark, Belgium, Portugal and Austria, who will be sharing case studies and successful initiatives from their own countries. And it's great to have the benefit of that knowledge and that experience from all over Europe. These presentations are a fantastic opportunity for us to learn from approaches that are working across Europe. This afternoon you will move into roundtable discussions where you will have the chance to explore these case studies further and share additional projects currently underway here in Ireland. Your goal is clear: to identify one or two practical initiatives that we can pilot right here in Fingal. And Fingal are very ambitious to pilot new things in Fingal, and we always have been and will continue to be, under the age-friendly Fingal programme, with the aim of scaling across the county to benefit to more older people in the months and years ahead. This is a working day, a day for action and ideas. It's also a day of connection and collaboration. That's very important. My hope is that every person here lives with new insights, new inspiration and new partnerships that will help us to build more connected communities. Thank you for being here. Thank you for your time. Thank you to our KORALE partners for travelling here and making the journey to join us. And thank you most of all to the members of the Fingal Older People's Council for your dedication. Let's make today meaningful. Thank you very much and the best of luck. Thank you.
Thank you, Mayor. Now, we're going to have some presentations. and we're going to hear from Debbie Breslin, who is the Deputy Chair from the Older People's Council. This will be followed by Dr. Rachel Kenny, who is talking about combating loneliness among older people in Ireland, and Rachel is from Alone. And then we'll follow with Suzanne Rogers, who is the chair of the Loneliness Task Force in Ireland. And we will have a panel discussion where the audience will have an opportunity to ask some questions, and this will be moderated, we're delighted, by Cathy Kelly. Now, we have our lovely programme of events, and the biographies of each of the presenters are outlined there, so if you want any more information, you can check out the programme. So, Debbie, if you'd like to come up, thank you.
Good morning. I've decided to do my presentation this morning without the assistance of technology, in the hope and a little nod that the art of conversation, the face-to-face transaction, and the voice-to-voice telephone call instead of an automated voice is not yet dead. Isolation and loneliness is nearing epidemic levels. Alone Ireland reported 28% increase in the number of older people from the years 2023 to 2024. That is 42 people per day needing more support. So, how do we communicate with the lonely? And how do we engage with the isolated? And why are they isolated and lonely? Well, let's have a look at some of the causes. The daily tradition of the Irish person consisted of a walk to the shop, going to church, and popping into the post office and meeting the neighbours along the way. But these services are becoming more difficult to negotiate as more and more are going online. Even showing the respect by attending a funeral is now quite acceptable online. Supermarkets having self-service checkouts, and in some instances, our neighbours are having to downsize and move away. Could the constant changes being made by AI technology be the reason we are no longer seeing the older person out and about? Well, have they lost confidence? Have they lost confidence in safety in their environment? I myself, as an older person, have certain concerns for my own safety. With the increase of antisocial behaviour, electric cars giving no warning of approaching, and e-scooters being driven recklessly on footpaths can be very daunting. Public transport can cause issues. The local buses no longer connect neighbourhoods to neighbourhoods. The all too frequent signs of lifts out of order on the train stations, and the gap between the platform up to the train and back down to the platform can be very daunting for a person to negotiate. And parking machines now operate using QR codes and apps. Even ordering a coffee is a challenge when you have to order using the QR codes and the contactless payment system. We see this more and more in supermarkets with the self-service kiosks and card payments only. It is reducing the number of human help. During COVID, we relied on an online way of life. Doctors' visits, keeping in touch with family, were all done by Zoom. Prescriptions were emailed, and shopping in household businesses was done online. It was all very successful. But why was it successful? Why? Well, we had the support at home, didn't we? Now, though, everyone has gone back to work, and life and technology has advanced, as technology does. But the older person is left again, lonely, isolated, with not too much human connection. Since lockdown was lifted, the challenge of living with and keeping up with technology is costly. Phones are expensive, Wi-Fi and electricity costs are high, and sometimes difficult for an older person to afford. Of course, these systems only work when the infrastructure is there to support it. No power, no services. Associations like Men's Sheds, Singing Circle, crafting workshops, and active age societies are all great ways to keep active in your community. And yet we are still facing these challenges. Could it be that the information for these activities is posted online? More and more often, libraries and community centres do not have parking. Perhaps we are back to the transport issue and feeling safe in the community. We used to have a hub of a community which was a source of information and communication. Now our communities are missing the post office, the local shops, and indeed the pubs. Not every community has a library or a community centre or accessible, affordable activities for the older person. The lack of social structure that was once part of our everyday life is disappearing. Or should I say, is it? Machines are more prevalent. The comfort found in a friend and a nod and a smile in the community is very slowly but surely disappearing. For those who have turned to furry friends for companionship, well, even they're restricted. And why am I even talking about dogs? Well, your dog needs a walk. It's a great way to get out into your neighbourhood. We have much to learn from our European friends in how to integrate animals into our society. How do we communicate with those who are isolated? How do we go to those who are lonely? How do we get them to engage? Through human contact, support perhaps, supported by technology, but not led by it. I myself am not against technology. I use it quite often with online banking apps like Revolut, FaceTiming my grandchildren, and I use a tablet for my ukulele music. But I'd rather go shopping with a friend or take the grandkids out for a treat. That doesn't require me to have a degree in technology to order it. I'm quite lucky to have tech support from my family members, but not everybody is. There are 4 videos on YouTube made with Aged Ireland called Rose from Fingal. And it tells the story of how Rose coped with isolation and loneliness during lockdown. Perhaps we should take a leaf out of her book. I asked my 5-year-old granddaughter what she thought about loneliness, and she answered, "Nanny, if you're happy, you're not lonely. Well, you can't buy happiness online. People need people." Thank you.
Thank you so much for that. That was really lovely to hear. And I think that message of people needing people is something that very much resonates with us as well in Alone. Thank you for having us here to speak today. My name is Rachel Kenny. I'm the Research and Evaluation Manager in Alone. For those of you who might not be familiar, Alone is a national non-profit organisation that supports older people to age well at home and stay connected to their communities. And I wanted to start by giving you an example of the types of people who come to Alone for support. Now, the names and some details have been changed here to protect confidentiality, but these are true case studies of people we've supported over the last year. So take Mary, for example. Mary is 65 years old. She has severe health issues that have left her largely housebound and isolated since moving into the area 5 years ago. She doesn't know anyone locally, and she does not have family in the area. The isolation, loneliness, and presenting health issues have really impacted her ability to meet people. Similarly, we have John. So this is a story from one of our support coordinators. He said, "I called to John at the end of January. He was referred to me by the HSE. He was extremely lonely when I first met him to do an assessment. He was struggling emotionally with the loss of his wife, and who he'd lost suddenly during COVID-19, and now lives alone. Since then, he has not been caring for himself properly. So this is just a couple of examples of the at-risk people who come to us for support. To give a bit of background and context, I'm sure we'll be talking about this throughout the day, but we know that loneliness is a prevalent issue in Ireland. The National Longitudinal Study on Ageing, TILDA, report that about 20% of older adults in Ireland report feeling lonely at least some of the time. And recent results from the 2022 European Union Loneliness Survey have identified Ireland as one of the loneliest countries in Europe. Now, it's interesting when you look at this study, a lot of that loneliness is actually dispersed across age groups. It's not unique to older people. But research by Aware, which alone supported over the last number of years, indicated that 1 or 3 older adults do feel that they're lacking companionship, lonely or isolated from others. So we know that this is a prevailing issue. And I think we can hear that very much in the stories and the voices of older people, but it's also reflected in the data. And the impact of this, well, we know loneliness is associated with poorer health outcomes. It's linked to premature death in a comparable way to obesity and physical inactivity. It's linked to other serious conditions, including diabetes, cancers, as well as exacerbating poor health behaviours. We know that it predicts hospitalisation. I was at the HSE Integrated Care Conference in September, and we had a very interesting presentation from a professor in Canada who did a study of hospitals across the states of Canada, and he looked at factors that predicted rehospitalisation once you had been discharged. And they used a big data model and they plugged in all sorts of health data, and they found it very difficult to predict what older people would be likely to be readmitted quickly. But when they looked at social data, and in particular loneliness came out as the strongest predictor of whether someone would be likely to be rehospitalised more quickly after discharge. So we know that these things are very strongly interlinked. And those most at risk of loneliness are those who are in poor health and those who experience difficulty with daily living activities, like John and Mary, who we spoke about at the beginning. So what's Alone's role in this? Well, as I said, Alone is a national non-profit that supports older people to live well at home and stay connected to their communities. Our mission is to transform ageing at home in Ireland and support and empower older people to be able to do that independently. We work with all older people. The 2 examples I spoke about in the beginning are examples of people who are particularly vulnerable at risk, but we work with any older person who wants to avail of our services. And we support them by providing our services free of charge. We have support coordinators in every community healthcare network in Ireland. The specific services that we offer are quite wide-ranging. I'm with Alone 9 months now, and when I joined, I was even surprised at the range of different services we offer. But some of the specific ones we offer around loneliness are, firstly, coordinated support. So everyone who comes to Alone gets an individualised assessment. And this is a holistic assessment of need. It looks at healthcare needs, but also needs across things like housing, emotional and mental health, finance, social connection. It's very much holistic. And through that, we help create individualised support plans for the older person, depending on what their individual needs are. We often signpost them to other community groups or statutory organisations or healthcare organisations in their community, and we've great relationships with those community organisations all across the country. We also refer them to another service that we offer, which is support and befriending. So Alone are powered by a network of volunteers. We had over 9,000 active volunteers supporting Alone last year. And these volunteers are instrumental to providing that visits to older people on a weekly basis or telephone calls to provide that social connection for those that want it or need it. We also have a very strong focus on technology, and we heard the role that technology is playing from our last speaker. Whether we like it or not, it's here. So it's how do we overcome the challenges that technology present to us and use it in a positive way to support older people to be more independent and to self-manage. So assistive technology is something that's pervasive across our services. We help people access things like the Fall Alert Scheme. We help people to digitally upskill so they can use things like tablets to be able to chat to their grandchildren, etc. And we do kind of intergenerational work around this, so we often work with young people who volunteer to help older people upskill in this area. So again, that's another source of connection, and using technology for connection is something we really focus on. And we also have our national support and referral line. So this line is open 8 to 8, 365 days a year, and anyone can call this. You can call this to refer someone you know to a loan, to refer to yourself to a loan, or just to get more information about some of the services we offer, or in general about services available to older people in your community. As I mentioned, we are very much reliant on our volunteer network, and the support that they provide to Alone enables us to deliver the services we do. We couldn't do this without them. We also have our community impact network. So as I mentioned, those relationships with community organisations is really important to us because we help people to access them. So we refer people to them, and those organisations refer people to us. It's very much an interdependent relationship. And our community impact network focuses on fostering those relationships around the country. And any organisation working with older people can become a member of our community impact network. And through that, we provide things like ongoing training, support, peer-to-peer learning. So if that's something you're interested in, you can email community@alone, or you can ring the NSRL number to find out more details. We also act as Secretariat for the Loneliness Task Force and the Loneliness Task Force Research Network. And I won't dwell on this because I know Suzanne is going to speak a little bit to this directly after me, but that's something that Alone is very much involved in. Who we support. So as I mentioned, Alone offers support to any older individual who wants it or needs it. But in terms of, I suppose, specific numbers, in 2024, we supported over 43,000 older people across all of our different services. About 59% of these were female, and about 59% were aged between 76 and 90 years. Something that we have seen over the last 3 to 4 years, year on year, is an increase in the number of older people availing of Alone services. So what I mean by that is we're seeing a massive increase in the number of people aged 86 and older who are coming to us for support. And of all of those we supported in 2024, I think it's worth noting that 67% reported living alone. When you look at the presenting needs of the people who came to us for support, you can see the most prevalent one is loneliness. So 1 in 2 people who come to Alone report having issues or experiencing loneliness. And after that, we're seeing physical health is one of the next most prevalent issues, and that's increased year on year, and we think that's linked to that increase in older adults who are coming to us. We also see that when you look at the people supported by Alone in comparison to the general population, the people who tend to come to Alone for support or be referred do tend to be a more at-risk group. So they report higher levels of loneliness, poorer health and lower well-being than a comparative group of over 65-year-olds in the general population of Ireland. Notably, compared to national averages, they report 1.5 times higher loneliness, twice the usage of GP services, and 7 times more emergency department visits. So it's positive to us in that we're clearly reaching a group who are at need, but we support about 2% of the population of older people in Ireland, and we estimate the need level to be about 7%. So there's still a gap to fill there. We also know that loneliness is a multifaceted and interconnected issue. So while 1 in 2 people report loneliness, they also tend to report a variety of other issues as well as that, showing the interconnected nature of these things. In terms of evidence and impact of Alone services, Alone is nearly up and running 50 years, and we hear all the time anecdotal evidence and really lovely feedback from the older people we support and their families and networks. But something that was very important to us in developing our research and evaluation team was to be able to have data to show this. So last year we did a study looking at older people referred to Alone. We did surveys with 273 older people who came to Alone at the time they were referred. We surveyed them again 3 months later and then 6 months later. And we worked with economists in the London School of Economics to help us analyse the data around this. And what we found was that older people who were supported by Alone, after 6 months of engagement, their loneliness went down, their quality of life went up, and their personal capability went up. And this is a measure of someone's freedom and ability to live a life that they value. And what was very interesting to us was those who were receiving telephone or visitation support and befriending specifically showed the most notable improvements. So just again showing the power of that social connection and improving outcomes across the board. In terms of some specific stakeholder perspectives, the feedback we get is things like, it makes you feel important, someone's thinking of you, a group of people, society cares enough about people to reach out and help them. And for example, I like this one on the right here, when you hear a knock on the door, when you live alone, it's like a beam of light coming into your life. So what's next for us? We're very much committed as an organisation to using our research and evidence to improve outcomes for older people at an individual level, but also as a societal level. So we use a lot of this data to inform our pre-budget submissions, our campaigns to government, our policy documents and recommendations. Some of the things we're calling out for are a national loneliness strategy, and awareness campaigns nationally around this, and again, Suzanne might speak to some of this as well. In terms of internally, we're looking to continue to promote and enhance our social prescription offerings, so connecting older people with sources of social support. And we've also, again, in the spirit of trying to use technology for good, implemented a project to use AI to help match volunteers and older people. So the way we've done that to date has very much relied on matching people within geographical boundaries. So even though you might have an older person living 5 minutes down the road from a volunteer, if they're in different geographical areas, the way our system worked, they weren't getting matched. So we're now using AI to overcome that and hopefully increase the number of people and decrease the amount of time older people are waiting to get matched with a volunteer to support. So where does that leave Mary and John, who we talked about at the beginning? What happened with Mary was the support coordinator said, I matched her with a lovely local volunteer, and as a result, she has someone who gives her company, confidence, and supports her with getting out in the community. On the first visit, she was able to go for a drive to the beach with the volunteer, and they walked on the beach together. This is a huge stepping stone for her, as before this was not a possibility. Following the match, I can see how much Alone has positively impacted not only on the older person's life, but on the volunteers also. And as for John, since taking him on, I've noticed a huge change in his mood and outlook. I have set him up with one of our volunteer befrienders, arranged meals on wheels, and introduced him to a local bingo age-friendly social club nearby he is able to get to easily. I'm also working on getting him new attic insulation from an SCAI grant and a heated body warmer to keep him warm. He is so thankful for the help that I have given him, and he told me that he wishes he had been linked into Alone services sooner. How to refer to Alone? Anyone can refer to Alone. You can self-refer, you can refer a family member or friend. You just need to ensure that you have the permission of the person you're referring, and you can do that through our website. We have an online form, or by calling that phone number 888 365 days a year. And if you are interested in volunteering with Alone, many of our volunteers are over the age of 65 themselves, and they find the experience hugely rewarding, not just for the older person, but for the volunteer themselves. So if you'd like any more information on that, come chat to me throughout the day. I'll be here till just after lunch, or you can have a look on our website, www.alone.ie. So thank you very much for your time and listening today.
Thank you. I need to put a stopwatch on because otherwise I could be here all day. As somebody who fully intends and hopes to age well in Fingal, I suppose I just want to say thank you for the opportunity to speak today. This does mean quite a lot to me. So we'll just see. Yeah, so I am current chair of the Loneliness Task Force. And I suppose to give full credence, though, lovely Lauren here in the front in the pink does all the actual hard work, so I just really want to acknowledge that before I do anything else. She puts a lot of this together. I think the difficulty is, what do we actually mean by loneliness? I think that's a really, really difficult one to actually pin down and define. So for the purposes of what we're doing, we say it's a negative feeling which can emerge when we feel our social relationships are not enough for us. And I'm sort of fascinated as well by, like, loneliness is used a lot in the Irish language. So you'll find these Irish sayings like loneliness of the forest. My own mother's from the west coast of Ireland. There's a very particular loneliness of the shore that's very specific to where they live. So there probably is maybe something in our psyches that, you know, is linked to that feeling of loneliness, it is really disturbing that 20% of the Irish population reports feeling lonely, when again our international, I suppose, our images, great crack, you know, storytellers, you know, Wheelie Wheelie Wallia, Céad Míle Fáilte, do you know what I mean? That we're a party people, that we're talkers, we're storytellers. And I find that really jarring then, that 20% of us feel disconnected and feel lonely. And again, it's a social muscle. And if I may, I remember, like many people in the 80s left here and went to work in England, and living on my own for a certain length of time in England, and between leaving work on Friday and going back in on Monday morning, the only words that would pass my lips would be 20 Benson and Hedges, please, right? So, you know, it's a social muscle. Being friends with people, it is a social muscle. It can get really flabby really, really quickly. And I remember distinctly, like in my teens, moving back to Ireland and going into the pub and being totally overwhelmed by all of these people. So again, even though the discussion today is as we age, we do see it linked across, you know, sort of multiple generations. It is linked, again, you know, I find all of this really, really fascinating, that loneliness does have a physical impact on our bodies. Early mortality, it's all bad news from here: cardiovascular disease, Parkinson's disease, dementia, depression. In fact, I have stopped smoking cigarettes since, because I can't afford them anymore. But, you know, like to think that the damage I was doing by smoking more than 15 cigarettes per day and feeling so disconnected and so lonely, it is quite extraordinary, those sort of statistics that we see. The Loneliness Task Force, which is what I'm here to talk about, it is a coalition of committed organisations. There are some invited experts and connected individuals, and it's really to increase awareness of loneliness and to continually push for that policy change. And I think, again, that loneliness it's a difficult one, because admitting to feeling lonely can almost feel like an admission of failure. What's wrong with you? Why don't you have any more friends? Why don't people seem to like you? Why don't you have anybody to go to for a cup of tea with? It's a really, really difficult space to be in. We've made huge strides in discussions about mental health. We've made huge strides in being able to say it's okay to not feel okay. And I think maybe loneliness will be that next part of that conversational journey, to say, look, I'm actually not feeling great. And sometimes even to recognise that feeling within yourself, that this is actually what I feel. I do feel lonely, and then what to do about it. So as you know, as the previous speakers have said, this is about trying to feel connected and then trying to put in a policy in place, because this can't be done by volunteers, unfortunately. It can't be done by us just being nicer to each other or kinder to each other. We need social spaces. We really need to look at poverty levels. We really need to look at older people ageing into the private rented sector. We need to look at immigration and emigration. All of these things have an impact on loneliness. So this is why we need that coordinated strategy. These are the member organisations at the moment. And again, as you can see, a really wide range of communities advocated for and represented here. I've read somewhere before that loneliness tends to peak 18, late teens, mid-50s, and then again around after the 80. And that makes total sense, because these are periods of massive, massive, massive change. 18, leaving school, maybe starting work, going to college, leaving that behind. Who am I trying to become? A whole new set of rules and regulations and a whole new community. Mid-50s, we're talking about maybe parents getting older and dying, you know, loss, divorces, children growing up, all of those things. And again, into that older age as well. And more of us will thankfully live to be much, much, much older. You know, being 100 now, first thing I do when we get the budget every year from government is go to this one page for the centenarians bonus to see how much money they've put aside for the few bob when everybody gets to be 100. And, you know, it's going up, and rightly so. But, you know, to age well. So it is about older people, but it's not just about older people. So again, that's the sort of organisations that we are engaged with. The progress to date, the task force was founded 2018. I wasn't involved at that stage. So again, I'll have to read this off the screen as well. But there was a Connected Ireland report released with recommendations in it. There was funding for a pilot initiative, which I'm sure as soon as I say the words pilot initiative, there'll be plenty of eyes rolling in the room, because we do brilliant policy in Ireland, we do brilliant pilot initiatives, and then so we are looking for, I suppose, something really to be put in place that is long term. Ireland is changing, we are ageing, we are a completely different demographic than we used to be. This needs to be long term, it needs to be cross-departmental. Roadmap for social inclusion, there's a new one due, probably the end of this year. It'll be interesting to see what's in it. Loneliness wasn't mentioned in the budget, it wasn't mentioned. Was it mentioned in Programme for Government? I'm not too sure it was, I don't think it was. We have, again, HSC, mental health promotion plans we've mentioned, social prescribing as well. All of these things are really, really important. So this is just kind of, moving through to see what work is being done. And unfortunately, policy can be slow sometimes. So it does feel a little bit, but we are very close to the end here. We're very close to getting the strategy written and delivered and across the line. So the submissions all went in, as I said, all the submissions went in to Lauren. She is finished pretty much getting all of that together into a vision, which is an Ireland free from loneliness. And it struck me even driving across, it really, really, really annoys me, but all new housing estates are behind railings. As you said, even if you go for a walk with the dog, we're being separated from each other nearly everywhere we go. We're being encouraged to be afraid of each other everywhere we go. You mentioned the e-scooters, you mentioned that sort of feeling of vulnerability every time we leave our houses. But how do we change that then? How do we create an Ireland free from loneliness? And it is going to require, again, cross-departmental, interdepartmental conversations from government, because this is a conversation about housing, it's about income, it's about access to local spaces, it's about sports, it's about crafts. And even when we talk about, older people getting involved in certain things, even that conversation will have to change. I did a pastoral placement a couple of years back, and in the retirement home, I think it was John Locke or John McCormick was playing in the corridors, and I was there going, it won't be too long before that'll have to be the Prodigy or, the Chemical Brothers or something like that. As that, each cohort ages, what does that look like? What do older people want? And again, this thing about joining clubs and going to bingo and all of that, like if you have no interest in doing any of these things in your 40s, why would you have an interest in doing them in your 60s? So it's just about making sure that the responses we have are grounded in people's lived realities as well. The thoughts of turning up for an over 55s dance class is a bit, I can just about remember the walls of Limerick from PE, when we were little. So again, just making sure that this is, and again, that's why all the submissions were so important that went into Lauren, that it's coming from communities, it's coming from community advocates, and that it will allow us to really feel supported and connected through the life course. That is really, really important, that keep looking at what do you want to be when you age, and lonely and poor and homeless aren't the answers to that question. Again, 10 priorities were put forward across 4 pillars. The awareness and the advocacy piece, again, really, really important. What are we talking about? What does it feel like? Can I admit to feeling it? And if I do feel it, what do I do about it? That the programmes to address loneliness, and again, that they are grounded in our lived reality, that they're not, okay, there's this theory and there's practice, but they're going to meet somewhere in the middle. That it's, again, grounded in that kind of high quality research. And I think that's really, really challenging, is to be able to see what difference does the policies that we've put in place make. Because sometimes the non-existence of something is your proof that it's worked. So that is going to be challenging. And again, action and accountability, that would be really, really key for, I think, any policy, is the implementation of it and the accountability of it. So if this doesn't work, can we pivot halfway through? Do we have to wait to the end of a 5-year to implement it and then say, well, that didn't work, we should have done something differently? That'll be really, really key. But as I said, at the moment now, we are almost finished ironing out the woulds, shoulds, coulds, muts, maybes, all the little slight changes in the words of the strategy. We said here now we will launch in November. For a good reason we won't be, because we have a lot more political engagement than we had anticipated. So it will actually mean that we are going to hold off for a little bit longer in order to get this across the line. So it's a delay, but for a very, very positive reason. And again, that this is just a conversation that needs to be bigger and broader and much more open than it needs to be. And I think it's funny because once you start looking at something, you see it everywhere. And I see loneliness now, quotes about loneliness pretty much everywhere I go. And there's one from, loneliness is hard to bear. We do need each other. We do need each other. We do need to be able to, and I think it's that thing that I think we're being polarised a lot across all of our different, where our lines are drawn. So I think we will have to tackle social cohesion as well as everything else through this. There was a report from Task which looks at poverty and inequality, but they looked at it through a loneliness lens this year, and that's exactly what they're saying, is that tackling loneliness will not only improve mental health, but will also foster social cohesion. Civic and political engagement but amongst young adults found that young people who live in areas with strong social infrastructure have more positive outcomes than those who do not. So again, this is about the family resource centres, the community centres. This is about the karate and the swimming and the somewhere to hang out. And I often think when we talk about antisocial behaviour, when we see 8 lads stood in a park somewhere, that's social behaviour. Do you know what I mean? Like, but you're kind of avoiding them. So we really need to be looking right the way across the board. One very quick quote then from, and again, I just think that loneliness, it isn't a failure of the individual, and I suppose really to try and hammer that bit home. There was, I don't know if anybody remembers her, Rumour. She was a pop star in the early noughties or early 2010s, I think. But she sold millions of copies of her album. So you presume that somebody like this is sorted and sussed and is surrounded by people and is happy. And there's a quote from her where she says, "I caught a glimpse of real loneliness. I caught a glimpse of real ice cold in your bones loneliness. It feels like you're in outer space, in a vacuum, floating around in space, alone in blackness to infinity." That is not what we want for anybody to have to feel if we can actually do something about it. So I think that is my last slide. Yes, it is. Hurrah. And I came in on time. Excellent.
So good morning, everyone. My name is Kathy Kelly, and I'm going to try and moderate the event today. So first of all, I'd like to thank Debbie and Rachel and Suzanne for their presentations. I learned a lot and was really surprised at some of the findings. So we've about 10 minutes now to open the floor for questions. So if you could be as brief as you can to get through as much as we can. But also, if we don't have time to take your question, make a note of it, because for the panel discussions in the afternoon, we're trying to identify some proposals that we can bring to Fingal for maybe an ongoing strategy in the future. So has anybody got any questions? And if you could say who you'd like to direct your question to.
Yeah, well, my name is Tony Brennan. I'm on Fingal Older Persons Council. I don't know who to direct this to, but I'm just thinking about social inclusion, and that's always coming up in different projects. I'm just wondering about, is there such a thing as economic inclusion? Because it costs money for everything. I'm just thinking about the healthcare service on the dental end of things. The dentist pulled out of all that on the medical card, and now it's very expensive to get teeth looked after. I'm just wondering, is there, and they never put it back in place, the government. Maybe the question is not for you, I don't know. Thanks. Anyway, it's a great presentation, by the way. Thank you.
Yeah, one of the pieces of work Alone does is around financial inclusion, and every year we compile recommendations for the government in advance of their budget deliberations. So we would do a costed proposal of what we see as the financial increases that need to happen to pensions, to living alone allowances, to key grants that older people would avail of, and we submit that during the summer, and we were invited in front of the Joint Oireachtas Commission for Social Protection to present that. So we didn't get everything we would have liked in this year's budget, but it's something that is a key policy area for Alone. So we see our role as to give voice to the older people in terms of specific financial needs, like the ones you've identified, like leads around kind of dental being excluded from medical cards. So it's something that we do lobby on.
Okay, thanks so much, Rachel. There's a lady down here.
Hello, I'm Marie Dunn from Balbriggan Senior Citizens. We run social Sundays. We do bingos on a Tuesday night. Now, the cost of them getting there is outrageous because the taxis are gone up. And to get there is €20. So old people haven't got that money. So I'm wondering, could a community bus pick them up? I'm not looking for nothing. They could give a little to the bus. So I just want to ask, how do you think people can socialise when they haven't got the money?
I think you're right. I think you have hit the nail on the head. Yes, while we're progressing with everything, we are forgetting the affordability of the state pension. And more of us are coming down that line to those unaffordable activities that are so important for your ageing mind, your ageing heart, and your overall ageing well-being. I think it is time that we started to look at a more affordable way of transport. I know we have the free travel card, which we are all very grateful for, but in little communities like that, there should be a community bus that will take you to your activities if you can't get there or can't afford to get there by yourself.
Absolutely, this is an issue. Thank you so much, Sarah. This is an issue that we're really aware of as well, and we keep hearing repeatedly from older people around the cost of transport, accessibility of transport in relation to social connection, but also things like getting to medical appointments. And I was talking to a man earlier from Fingal who operate a community car, which is volunteer-led to help bridge some of these service gaps. And I'm very interested if anyone knows of any other community initiatives working in this area. We're doing a piece of research in London at the moment. We're trying to speak to organisations around the country who are offering transport solutions for older people to look at what are the recommendations that we need to make at a government level to try and bridge some of these gaps. So I'd love to have conversations around that with anyone today who has any information.
The problem with the community car is insurance. If you're carrying a passenger and something happens in the car, it kind of puts you off offering lifts, which leaves them isolated, really. It's one of the big challenges. And who knew a beautiful smile was classed as cosmetic for the price of dental? I do agree, Tony.
So if anyone else that would like, yeah, this lady over here.
Hello, my name is Carmel. I'm here with some volunteers, and we work with the senior citizens. Okay, so I want to ask a question for myself. As volunteers, and we're working with senior citizens, and we see people are getting older and older, and old age is creeping in, and we're becoming aware that we feel that maybe these people are lonely, and we feel that they need help, and we can see they're surrounded at times by their family, but what we're hearing, families are not helping, whether that's true or not, or we talk to the families and we see nothing is changing, and people are getting older and they need more support and help, and that person or persons are not looking for that person. That person's not looking for help. So what do? Just stand by and we just let it happen, or do we just, what do we do? What, where do we go from there? Like, we're afraid, to take steps that they're the wrong steps. So is there anybody that can help us from alone, or any of you three ladies up there can actually suggest something for us to do, because we don't know what to do?
I might weigh in on that one. I think that autonomy still needs to be the key, I think, here. But that is a really, really difficult space, and I know that then you're into sort of the safeguarding aspect of it, and as you said, competency is presumed, capacity is presumed right the way across the board, no matter what it is. That probably doesn't change, and I think if somebody is capable of making a decision, it would I mean, maybe all you can do is lead the horse to water and say, look, these are the services that are available, and set that out for somebody. But that is a difficult one, as you said, if you feel that. But I suppose we probably all do that. We probably all look at people we know going, do you know what she needs now? I'll tell you what she needs to do. You know, it can be a very, very difficult space to go. But just to pick up on the previous question, like Fingal fascinates me because it's highly urban and highly rural. It's got pockets of immense wealth and then pockets of deep deprivation. So it's a really, really challenging, you know, I suppose, in such a small space, because people think, oh yeah, well, if you're in Dublin, you have access to a bus, and if you're in Dublin, you have access to this, and you're kind of, well, not in all of it. And again, so it does, I think it makes the conversations, even within that small pocket of Fingal, it does make it really, really challenging. But I think, you know, hopefully, I think all you can maybe do is highlight that there are places to go, people to see, things to do, and hopefully somebody would pick up on that. But I'm very conscious of that, like, because the landscape is getting more complicated again, but like assisted decision making and you know, all of those things also play into how we interact with each other, and that is a challenging one. Maybe we'll come for you maybe afterwards and have a chat offside. Thank you.
So unfortunately now we only have about another 2 minutes, so we can just take one more question.
I might take more than 2 minutes.
Okay.
Anyway, right. I didn't intend to speak on this, but I have a captive audience here. So housing and housing for older people. I want to raise that issue because it is relevant to loneliness. So I've been lobbying for 4 years at least. I've been working with somebody who wants to build housing for older people. And, you know, it can be sensitive in how you describe it. But the phrase I use in the council meetings, I'm trying to get attention and trying to score and trying to impact old, cold and lonely. So old, cold and lonely in a large home that's inappropriate for your needs. And people want to stay in their homes, that's fine. But there are many who approach me who would like to move, who would like to move to a warmer home with less tax and stay in their own community. And what are we doing about it? Well, presently, I'm unaware of anything that's making an impact in that regard. And I have visited all the Sue Ryder homes. There's a Sue Ryder complex in Dalkey. There's a queue of 400 to get into the cottages there. It's very successful. What would I like to see? I'd like to see equivalent of Sue Ryder in every town and village in Ireland, every town and village in Fingal. And I've been lobbying ministers. I've lobbied a lot of ministers. I've been in and out, and I'm still in and out, and I'm not giving up. And the proposal that currently sits with me via this gentleman who built 15,000 retirement homes in Australia. He's Irish and he's back home. He had to leave the country in the crash. He's back home and trying to push it here, is what's known as rent for rent tax relief. So what does that mean? You get tax relief if you go into a nursing home if you have to. You can rent your bungalow and pay for the nursing home charges, pay no tax. Why can't you rent an apartment in a bespoke complex like Sue Ryder, keep your home and rent your home and pay for the charge of the apartment? You don't like it, you can go back home. So I'm pushing that proposal. There are 750,000 bedrooms in homes that older people occupy that are not used. Now, I don't use that in a negative manner, but there are homes out there that could be used better. I'm aware of 2 in my town in Skerries, 2 84-year-old people in 5-bedroom homes who'd love to move to a bespoke complex with 40 or 50 units where they would have company, be independent, have their own apartment, their own house, have assistance on call if they need it, and as they grow older with services attached. And the proposal that the gentleman I'm working on with has all that, including the HSE. So my question, sorry, is back up to the stage.
Yes.
And is there anything about housing in the proposals that are going to government? And I've just asked for the contact details of Suzanne and Rachel, because I'd like to give you the details of what I'm up to, and I will persist. But I'm telling you frankly, and I'm a Fingal councillor, and I used to work for a Minister for Health, we're not addressing this issue, and we must address this issue. Not to force people out of homes, but to offer to people in their own communities. And in Skerries, we've been trying it for 20 years and we haven't got anywhere yet. Anyway, I'd be interested to hear if there's anything about housing to deal with loneliness in the proposals.
I'll be
Thank you.
very quick. If
So
there isn't, we'll add it.
Could you
Yeah.
maybe chat, you know, after this, because I'm very conscious that you're all probably down for a cup of tea or coffee, and you can go outside and have that now. So thanks so much, everyone.
Okay, everybody, we're going to start again. And I am delighted that we have our 5 partner countries and ourselves in Ireland presenting on their good practices in addressing isolation and loneliness. And our first partner is Addenbury, Basque Country in Spain. So if you'd like to make your way to the stage, thank you.
Good midday, good morning, late morning. Well, I'm very happy to be here, and I'm going to share a challenging aspect with you. You'll have to understand my thick accent, which is not easy, but I'll try my best, okay? Let me tell you about the Maitaro project. Maitaro is a word that does not exist in the dictionary. It's a new word that we created for the project. Maite means, in Basque, love, charming, companion, all these positive things. And aro means the time for this. So it's the time for love, more or less. But it's a funny and beautiful name. Okay, as you see there, we're interested in connecting people, connecting institutions, and connecting generations. These are the 3 things that we want to connect, not only one. And because of that, we have the support of all the main authorities in our region of Guipúzcoa, in northern Basque Country, Spain. So we have the health, the foundation, the Diputación Foral, which is our provincial government. We have the Basque government. We have the Telephone of Hope. I belong to the Telephone of Hope. And we have the City Hall. We have everybody. And I think that's very important. And this is very important for us. When you have a project, you have to involve everybody, not do it yourself only. Okay. Now, we have the Addenbury system, and that was presented in previous meetings here. This project they're going to hear about is an experimental project, and we are doing it, and it's part of the General Action Plan against loneliness in our province. And we have different projects. So today we're going to present this project, a small one, and it has to do with primary and tertiary prevention. And then, well, there are many things, but it's important that is the public conversation. Many people in our communities do not know and do not understand the implications of loneliness in different ages, in different groups, in different parts of the community. So part of our work is to create this network, to organize it well, to innovate, to produce things, and be able to tell you what we are producing, and as well as get into the public. Okay, the purpose of the project, basically in synthesis, is like this, is to identify loneliness and social isolation in patients at a mid-term hospital. We have a big hospital, we have the mid-term unit, and then the project started, in fact, because of the nursing staff and the social worker at the hospital identified people that had no visits. Okay? Then we want to provide support to them with young volunteers. We go both ends of the generation. And then the third thing is to continue the support when the person is discharged from the hospital and goes, you will see wherever the person goes. So this is the hospital up there. It's the largest hospital in the Basque Country. It's very big. And that section with the red arrow is the one that is for convalescence unit, the mid-term unit, which the other part is more acute than anything else. So then we had that, and the staff, medical staff said, we have these people that we are concerned about. They're beginning to think about lonely people. Then what we did, we went to 2 schools, training schools, and we addressed the young people and asked them to volunteer. We explained to them the Maitaro project, and we asked them, raise your arm if you want to be considered a volunteer for that. And we went directly to people, to students that were involved in social care, healthcare, social integration. In other words, we didn't go to engineering. We went to careers that had to do with people, so to speak, okay? Then we selected the volunteers, and after the volunteer selection, we organized a 15-hour training program for them. So it's not sending a volunteer and you do it. We had to train, they were trained, and we had to follow a structured curriculum. And if anybody is interested in the structured curriculum, we're more than happy to share that with any organization, of course. But it's a classical one of how to provide support to people. Then the volunteers pledged to be 1 day a week for 6 months, minimum. That's the contract, so to speak. They signed confidentiality agreements, they were insured, there was insurance provided for them, and some funding for traveling to the hospital. But this is not a practice of the school. It's a volunteer thing that they add to whatever practice they do in the school, okay? And, well, we prepare also for them saying goodbye, because it's challenging for them to get in touch and to say goodbye, and for the people as well, for the patients. Okay. And to have follow-up. Okay, I think it's very important, this down, the staff, the medical staff was the one that matched the person and the volunteer. And if it doesn't work, we change the patient and the volunteer. So it's very flexible and personalized, and it has to be this way, okay? These are our results. This is an ongoing project. It will finish next year, so every day the numbers change. This is yesterday numbers, okay? But it will be different next time. We have had 47 patients, 27 men and 20 women. The age bracket is between 32 and 103 years old. Well, the majority, the mean age is 68. But we also have younger people as patients. These volunteers made more than 200 visits. And every time they make a visit, then they get a phone and they send a vocal message to our coordination office saying, how did it go? If it was all right, if there was any problem. So we recorded that. Every 2 months, they have groups meeting to see how things are. And if there's any problem, we go and start again with them, okay? The satisfaction of the patients was 9.1 over 10. Brutal, I mean, fully satisfied. They felt less lonely, much less lonely after this visit. And we don't tell them what to do during the visit. Each person, each match, decide what to do. Some wants to talk, some wants to stay, some wants to talk, some want to listen to music. I mean, you respect whatever people want to do. And it's oriented towards the desire, the wishes of the patient, not of the volunteer. And we train the volunteer for that. Felt less lonely, 90%. And we asked the people, the patient, will you recommend this to a friend? I say 100% yes. Of course, yes. So we were very happy. The volunteers, we had at this point 18 volunteers, 11 women, 7 men. So far, we had 4 that had finished their pledge, their rotation. Satisfaction, 9 out of 10, equal than the patients. And many of them made comments saying, this is incredible. This is adding me a new dimension in my life. And to hear that for young people who will be the next old people and who will be the next volunteers, I think it's a good investment for the future. Okay? The staff also fulfill expectations. They said there is evident psychological and physical benefit in the people that had these visits. They require less medication, less analgesic medication. They are happier. They don't call so many times the central office of the nurse. So they're very extremely happy. In fact, they want to expand this to the whole big hospital. And we say, take step by step. We don't want to do big things. We say you have to think big and act small. And if you want to copy, you copy. Thinking big, but acting small. If you act really big, it's very difficult to do. So the potential for learning and for transfer to your initiatives is extremely good. You focus on getting a better hospital, a hospital where the patients are human beings, not patients alone. And I think that's fantastic. And I'm a doctor, so I can tell you that's very important for the doctors as well. We have doctors involved in this, and they change their mind about the patients, okay? You have the staff identifying lonely people and people that need support, which is really a new thing. You have collaboration, trust, commitment. You have the relationships, and we have people here in the group of patients that die. We have 4 people that die. And it was kind of hard for the volunteers. But one of the volunteers said, I learned so much with his death. I felt very bad, but I learned a lot. And so I think it's great. So you have to train, you have to engage, you have to have volunteers, and you have plenty of volunteers here in Ireland. So my message is just do it. I mean, it's no mystery here, just do it. Thank you. Thank you so much.
Well, good morning to you all. I'm absolutely delighted to be here representing my institution and my country. I'm from Portugal. I don't know if you ever had been a police officer talking to you, but there's always a first time for everything in life. I'm a police officer. I'm commissioner from the Public Security Police in Portugal. And I'm here to talk to you about the good practices that we do with the elderly and combating loneliness and the isolation. My English is not the best, but if you don't understand anything, please just interrupt me and question, okay? Feel free to do that. Before presenting the agenda, for me to present what we do in practical with the elderly population and to combat the isolation and the loneliness, I think I have to explain you how we work, because police officers have a lot of valencies, a lot of duties. So it's one specific duty that we have, that it's called community policing, and going through the community, specifically with the elderly, with the most vulnerable people, children as well, victims of crime. So we developed a few years ago this program, but before I have to let you know how we work in practical ways. So this is the agenda, our nature, our mission, what we do, and how we are organized in Portugal. Of course, our security strategies that we have, there are a lot, and specifically the community or proximity policing, as we called, and the special programs that we developed through the years. So, our nature, the Public Security Police, is a security force, uniformed and armed, with the nature of public service and endowed with administrative autonomy. Our mission is to defend the democratic legality, ensuring internal security and the right of citizens, as I think each police in every country. Where are we? So we are across the country in every district capitals from north to south of Portugal, and in our islands, Azores and Madeira. If you don't know Portugal, well, you get to know right here. We have a resident population of approximately 10 million inhabitants. And the visitors from last year, approximately 29 million in our country. With I'm sharing this information for you just to know that we are a small country, but a lot of the years we have to secure a lot of people coming to Portugal, tourists and everything from the international airports. We have to secure more than 70 million people, and by cruise passengers, approximately 2 million passengers. How are we organized? I'm not going to spend a lot of time here, but it's just for you to know that we are represented in each capital of district in Portugal, from north to south of Portugal, and we have district headquarters, regional headquarters in our islands, and the metropolitan headquarters that are the biggest in the capital, Lisbon, and Oporto in north of Portugal. We also have our special unit police, forces and 2 police academies in the country. Total, we have 396 police stations in Portugal. Just some information for you to know. About our security strategies, and here is where I like to share that the police is an integrated response to everything, okay? Since public order, fiscalization and administrative police, road or traffic security, private security, intelligence, weapons and explosives. So we do a lot, and there isn't enough police officers to everything. That is just what I wanted to share with you. But the project and the security strategies that I bring here to share with you, it's our community policing, our proximity policing. This is our mascot, Falco, to the children. But how did the community policing arrive in Portugal? Well, it all started in the 20th century when people started to prioritize the fear of crime, the quality of life, the petty crime and the incivilities, and the focus turns to criminal prevention and problem solution. And that's how we get, in the 21st century, the community or the proximity policing. We, the public security police, we implemented this community policing in the 21st century. So it was a difference in our way to secure people. We fight against the social causes of crime by improving the standard of living and promote equality in cooperation with other agencies and the community themselves. So we get to the street, we get with the social entities, and we provided security among the community. What is this community policing? We called it in Portugal integrated model of proximity policing. So we had a redefinition of our police functions, we reordering police priorities, we focus on crime prevention and solving the causes of crime and incivilities, so better to react, we prefer to prevent the crime. So we empowerment the community's role, we develop a closer relationship with the population, and of course with that we promote citizenship. So we created special programs for these groups, as I said before, for the victims of crime, a program for the prevention of domestic violence, a program for the people with disabilities, Safe Pharmacy, Safe Commerce, our oldest program, Safe School for kids and teenagers, Safe Taxi, and for the last but not the least, the elderly in safety. So we developed 2 teams of police officers. The first one was for Safe School teams, and the other was for proximity teams and victim support. And I'm going to talk about this specifically because these are the teams that are dedicated to carrying out patrol actions directed at especially vulnerable groups, including prevention and surveillance in commercial areas, surveillance in residential areas inhabited mostly by senior citizens, prevention of domestic violence, support for victims of crime, post-victimization monitoring, identification of problems that may interfere with the security situation of citizens, and we created the special program for the elderly. It's called Support 65, Safety for the Elderly, the elderly. This is a specific program where we go to their houses when we do some lectures to prevent crime situations. Of course, by this creation of network of direct and immediate contacts among the elderly, people gain trust with the public security police. They call us to our house. If they need any assistance, we have some special or specific phone numbers for them to call. And of course, with that trusting relationship, we help to prevent and avoid risky situations. So our goals, our action among the elderly population is part of a preventive approach. This is our main goal, because we organize and participate in training sessions or raise awareness actions of criminal prevention with subjects that are relevant to the seniors. For example, scams. Scams is a lot of common in Portugal, mostly with the new technologies. We visit the senior individuals in their houses for assessment, monitoring, and referral of elderly people to social support institutions. If they need any assistance that it's more than the police officers can do, we refer them to the social institutions such as Santa Casa and another. And of course, increase the policing in public places most frequented by the elderly, where they frequently play cards and so on. With this program, we created a campaign that we do it every year. It's called Solidarity Has No Age, the PSP with the elderly. This campaign aims to detect cases of social vulnerability, cases of physical and mental vulnerability that can compromise their safety, suspected cases of domestic violence or other crimes against life or physical integrity. So we provide the necessary support in coordination with other entities. We like to say that we're not alone. We can't do everything to help by ourselves. The police officers need the social responses to actually help the most vulnerable groups. So over the last 13 years of this nationwide operation, police officers conducting daily door-to-door visits that have been assessing elderly people in situations of neglect, inability to support themselves due to their physical, financial, or other difficulties, or repeated exposure to violence such as physical, emotional, or psychological, providing the appropriate referral services. This is, I think you already know, at least the KORALE members project know, the Projeto Radar. It's developed by Santa Casa da Misericórdia, but of course we participate because we go on these door-to-door contacts to do this assessment that I was telling you about. We also have this campaign. It's called I Am Here Adults. This is nothing more, nothing less than a bracelet that we give to the elderly, mostly to prevent risky situations. Let me just show you the bracelet. So this is the bracelet. The wristband has an alphanumerical code with 1 letter and 5 numbers, and the registration call 911. In Portugal, it's 112. Yes, it's the European number. So the bracelets are intended for people who, due to their age or medical condition, may become disoriented or unconscious, even if only momentarily, in public places. So you can go to each police station, ask for the wristband, and if anything happens to you on the street, the person that sees your wristband call 112 and says the alphanumerical code and connects to the person of your family or your friend that goes quickly to support you anywhere you are, okay? This wristband doesn't have a GPS tracker, or it doesn't connect immediately to the hospital services, but once you called 112, there's obviously a response that the police officers give to you in each way. I got to the end of my presentation. This image was one of our lectures that we give in our Metropolitan Command in Lisbon for the elderly. It was a presentation in the project that we used to have that was called I Am Digital, and we spent a morning with the elderly talking about scams, how to prevent it, how to create an email account, how to create your social media, but everything within the security and the safety of using your new technologies. We like to say with this police proximity and social inclusion, we help to prevent and decrease the risk and the vulnerability. Just a quick video for you to know our police in Portugal, but thank you very much for your attention.
Good afternoon. After that last excellent presentation, I have a few gentle words. The first is, I'm moving to Portugal. By pure chance, we've just booked a trip there to the Algarve this coming weekend. I may not be back. So please take in all my words, you won't hear them again. My name is Sean Corrigan, as you can see, and I'm a local coordinator with the Men's Shed Association, voluntary coordinator. The Men's Sheds were established initially in Australia nearly 30 years ago as a factor of a natural disaster where some men came together in a community, and working together they were able to resolve some of the issues. Out of that started a network, and now there's over 2,000 sheds in Australia. The Shed Association came to Ireland in 2009, and at this stage there are over 450 sheds in the country, with about 10,000 participants, and that number is growing all the time. Each shed is independent and is established by men in the local area. The Men's Shed Association itself provides guidance on governance through a network of volunteers, such as myself, in each county in the country. I'm one of two in Fingal. We look after 14 sheds in Fingal and another 6 in the North County Dublin. We are supported in our work by Fingal County Council, who've been of great assistance in establishing the sheds in the county. Sheds, when they come to mind, you might think of a workplace. And you would expect to see a range of tools in a shed, hammers, screwdrivers, etc. However, I'd like to introduce you to the most important tool in every shed in the country. This tool is central to all that matters in the shed: conversation, companionship, and friendship. The kettle. It's the first thing that goes on every morning when the shed is opened, and it's important. And it is what the shed is about. I've, I think, 5 points I'd like to make this morning. First, sheds are located in central locations. A core requirement of establishing sheds is that they're located in local areas with easy access to members. This is important as many members are aged and may not be inclined to travel long distances. Sheds based in communities are most likely to receive support from local sponsors and engage with other community services. Companionship. Companionship is critical in a shed. Sheds offer many benefits to members, the most important of which is companionship. Many members are retired and miss the daily connection to former colleagues. Sheds offer men an opportunity to come together in a friendly, non-competitive environment to spend time with other men, share skills, engage in community activities and projects to their own benefit and to the benefit of their community. Activities. when you visit the displays downstairs, you'll see a full range of our activities. I'll just mention a few. Every shed is different. Some sheds have workshops where the men use their skills to produce benches, plant boxes for growing flowers or vegetables. Also, men can learn new skills while working alongside other men. Other men's sheds may not have premises or workshop and engage in social outings to museums or places of interest around the country. Some sheds have choirs and musicians. Some, or many actually, engage in walking. In fact, in our shed, and I'm a member of a shed in Balbriggan, a number of the men over the past few years, and also in Swords and some others, have actually taken walks in Spain on the Camino de Santiago. And in the year ahead, our oldest member is planning to celebrate his 80th birthday by walking 800 kilometres across northern Spain on the Camino. So, the men in the sheds decide themselves what activities they want to engage in based on their interests and skills. Health promotion. An important element of the support provided by the Irish Men's Sheds Association is health promotion, with a particular emphasis on issues related to older men. This is conducted through online programmes, leaflets and talks. You'll see if you visit us downstairs, we have a toolbox. Normally, when you have a toolbox, you have it full of hammers and nails and screws and whatever. Our toolbox is full of literature from various organisations supporting and promoting good health in mature men. Every shed in the country has one of these boxes. The Irish Men's Shed Association has a full-time health promotion manager sponsored by the government's Health Service Executive. Advice. An important concern for older men is physical and financial security, particularly when living alone. Initiatives taken in sheds to support this includes inviting talks from relevant parties such as Gardaí, our National Police Force, on personal safety, banks and credit unions on financial safety, including online and cyber crime or safety. And also, some sheds have invited solicitors in to encourage men to consider making wills, all the practical sort of things. And they are just some examples of some of the advice given. So, in summary, to encourage men to join the local shed, we advise them that it is not your skills that matter, it's your presence. Thank you.
Good afternoon, ladies and gentlemen. I'd like to introduce ourselves. My name is Mary Farrell, and my fellow committee member and friend is Jennifer Maxwell. And we'd like to tell you a little story of Active Age. Are you okay? I'm just so short, sorry. Can everybody hear me? Now, I have to admit, this is my first PowerPoint presentation, so you have to be kind, okay? Now, Active Age wants its members to stay independent, healthy, and to combat loneliness. Now, it started in 2014-2015 when a steering committee commissioned a study which was Forming the Future, an independent study of the community needs in the Donabate Peninsula. And one of the recommendations of this was that social and activity-based opportunities will be created for older people. And this committee had local representatives, and Sinead Wiley and Louise Edmonds, who is very instrumental in starting Active Age. And at the same time, we had a group of newly retired locals who wished to participate in classes in the community centre. They didn't see themselves as senior citizens. And a trip was arranged to South County Dublin to see the activities there and how they were organised. And on the way back, all the busload were on the first committee. So they made use of us. Now, this group returned inspired. They were interested in morning classes. The community centre had space off-peak times, so this would work. And Active Age was officially launched in January 2016 when an AGM and a new committee was formed. Now, we were funded by Fingal Fingal has been very instrumental in our setup all along. Sorry. We had a Fingal, sorry, did I? Okay. This committee had a diverse experience going from counselling, education, recreational planning and finance. And they wrote a mission statement, which we still stand by. Active Age for All provides opportunity for older people to engage in social, cultural and recreational activities and events in an open and friendly manner. A constitution was written and it was decided that we would follow a self-determining model, which we still keep to this day, and volunteerism and community are high on our agenda. We were funded by Fingal. It was a startup grant of €1,000, and each new committee member put in €10. And I see our first chair is here sitting in front of us, Peg McManus, and Jess Lowndes is down here, and she was very instrumental in the setup of Active Age. Now, over the following months, many taster classes were organised, trips, tours, free and paid classes started. We're a non-for-profit and our annual membership is €10, and we have 2 12-week terms. We don't have half-term. And now I'll hand over to Jennifer.
We're like Morecambe and Wise there. Actually, I was just thinking a little moment earlier there about the difference that happens at 65. In my case, my free travel pass arrived 2 days before my birthday, and then suddenly you think, oh, I have no work to do. What do I do? And when Mary said there about the group of people who just happened to have retired at the same time, I certainly wasn't ready to be a senior citizen then. 10 years later, I might be. I am. But then I wasn't. And that's really important in the like of setting up something like this programme. Get them early at 65.
55.
55 is our group. Anyhow, this shows the census in Donabate of people over 60. And the numbers are really very interesting because we have 301, actually we have 302 from last night, paid up members, or 32% of the number of people who are over 60 in Donabate. That's quite dramatic. It also has implications for running classes. Of that 32%, 24 is male and 76 is female. So 1 in every 4 of our members, we're thrilled, are men, which is great. So Mary was saying about the talents that were there. Well, the top first database was built by somebody who knew a little bit about databases, because we had to find a way of knowing who our people are. The second one then just shows the new bit from our website. Okay. When we're doing things by website, we also have to remember that 2/3 classes get put on the website, the other third, it's in person. We can't assume everybody is digitally alert. So that's a big challenge for us. And up in the next one then, very quickly, we have had huge support from Fingal County Council. They've watched us grow and they've been willing to take risks, I think, with us. We get an idea, we talk to somebody, and they say, yeah, I think you should try that. And we do. And thankfully, most of it has been successful. Back to you, Mary.
We run 30 sessions a week, classes ranging from for the brain and for the body. Ranging from, I thought I had a loud enough voice that you could hear me anyway. So they range from French to sit and get fit, so for mind and body. Now we find that socialising after class is just as important for isolation and loneliness as attending class, and we have a very good cafe and people congregate there for a coffee after class. Then we started new classes, and one of them was Stronger for Longer, which grew out of the fact that some of my friends couldn't get themselves out of the bath. So we organised a strengthening and balance class run by a physio. Silver Threads was a memoir writing class, which Peg here, our first chair. Her memoir was published last year directly as a result of this memoir class. I Shall Be Good. Now, and croquet and boules, we were very fortunate. We were supported in this by Fingal. They had a croquet ground which was very overgrown in Newbridge House, and they refurbished it for us. And boules the same. They set up boules courts for us. Now, where am I? Now, okay. Where we have also hived off many groups, the Leader and Men's Shed, Cycling Group and the Peninsula Pacers.
Okay. And the one, we're really moving to the end now because I see people are panicking a little that we're running over. COVID didn't beat us. The thing that came out of COVID was it rejigged the fact that we knew a lot more people than we realised. Fingal worked and local bodies worked with us for us to find people that we now knew were isolated and might need some help. So it was absolutely wonderful. Our meetings were held by Zoom. We held classes by Zoom. And you'll be wondering about the Christmas tree at the beginning. Well, the Christmas tree comes up again. We used that as a basis for gathering together all sorts of other groups, ICA, craft groups, and we asked them to make a piece for a Christmas tree for the community centre. Children in school made decorations for it, so we tried to make it intergenerational. And generally, we got a lot of publicity from that really funny-looking Christmas tree. So just try things. The Christmas tree, by the way, didn't go into the attic as normal. The ICA ladies took it and made knee blankets from it and presented them to the hospice, and now we fundraise for the hospice every year at Christmas. Okay, Mary? Oh, yeah.
Finding the right people for your committee can be difficult, as we all know, trying to find volunteers and the right volunteer. So every year at our AGM, we approach people and we talk to them and we try to recruit them. And we do the same at our registration. We produce monthly accounts, we're very diligent, and we meet monthly. There are 16 on our committee. We have had tutors for 10 years, which is really important because it keeps people coming to class if they're popular. We also do a monthly newsletter, and including the age-friendly newsletter. Now, we're nearly done. Now, to attract new members, we are supported in these by Fingal. We had Give It a Go Day, the Bealtaine Festival, Silver Threads. Positive Ageing Week was very successful. We had a singing class. We taught people 3 songs, and then we produced a concert at lunchtime with food from our volunteers. Now, I think we're at the end of our presentation. We manage our money, our budgeting, and we have money reserves for taster classes, and we top up grants, and we also got the Get Moving programme, which was originally funded by Fingal, and we produced information packs which we gave to all the local medics, and offering reduced fees for classes, Sit and Get Fit, and chair yoga. This is a very successful programme, and we wish to continue with it. Now, we've reached the end of our programme. Here, go back. Now you see all the active agers being in the swing. That's croquet, boules, and pickleball. And thank you very much for your attention.
I've just one very short story on the Get Moving programme. We did produce brochures and things for doctors, but I was dealing with a gentleman, it'll become obvious in a minute, and he said, "There's your printing," and I said, "Fine." And he said, "I was in with the doctor the other day," and he said, "So, are you doing any exercise?" "Well," he said, "since the dog died 3 weeks ago, I really don't get my walk in, but I'm still playing golf once a week." And he said, "I've got the very thing for you." And he said, he pulled out the drawer and he handed me one of your brochures. It was the man who prints our brochures. So he was well impressed.
Thank you very much. If anybody has any questions, we'll be available later.
Good afternoon, everybody. I'm Chris. No.
And I'm Nicole.
I'm 65 I'm retired, but I'm still active as a volunteer, and since recently I'm the chair of the City Seniors Advisory Council. It's a long name.
And I'm Nicole. I'm 70 years old. I'm actively involved in community life, and I'm also a vice chair of the same council.
Okay, we're going to tell our story, how we have started and what we are doing for the moment. So all started after COVID. We had an existing advisory council, but we realized that it needed to be reinvented, and before it was more a symbolic role it has, and we have it invented as a more active partner to make policies and regulations for all the elderly. So our motivation to participate to that was, as I heard it already before, was to ensure that the policy is better aligned to our daily reality, because we live our life at 65, and as already said, when you go retired, your reality changed completely, also for me and I think for everybody. So you need to reinvent yourself to do what I'm going to do, what do I want, what do I desire. That's very important.
So now we are pleased to show how we organize ourselves and to show you our work today.
So our goals was, we stand here now today as the Retro Raad. So we had changed our name. We don't like elderly or old. We are retro. So our goal is, in fact, as I said here before, we want to present our senior citizens. We make also their voice heard in the policy and decision making. So we don't organize a lot of activity as traveling and so on, but it's more we want to have an impact that elderly will have on the policy makers. We strive also very hard to a positive image for elderly, because we think they are very negative in the media and also in society. Older people, they are sick, they can't do anything, but I think we can a lot, more than they think. We want also encourage lifelong learning. I've seen that you also have very initiatives. We are very favorite for that also. And important is also that seniors and old people together think about their problems and participate in what happens in their daily life. Okay, I have to continue. Okay, good. We based our work on the World Health Organization. I don't know if you're familiar with the age-friendly city. So our idea is we're working together to build an age-friendly city for everyone, but we are retro. We have a focus on the elderly. So very important. And the mission, it's your turn now.
The mission is working together towards all age-friendly city. And we want to act as key figures. That's a very important thing for and behalf of senior citizens in their action with policymakers.
Okay. So how this journey has started? As we said, we started after COVID, so we have to rebuild everything from scratch. So we get some sessions where we brainstorm with elderly and also with people from the city. What should be the role and our function as an advisory council? Now, after that brainstorming, it was also that we were officially recognized by the city government, and I think that's very important to get their support, because you cannot do it alone, you need some support, and that's very important. In 2022, we had a research of the needs for elderly, and it was conducted by the University of Brussels. Now that gave us a good insight what our elderly needed, wanted, wishes, and what they would struggled with, because you cannot start with something if you don't know what the problem is. And based on that information, we made a memorandum. I don't know if you know it, a memorandum. Okay, so we made it for the elections of 2024, and we gave it to the politicians. Now, it was the first time that issues of elderly were prominent in their manifesto. So it was a success that we said, here, this is our document of our wishes, and we want that you take it with you in the next election and the next turn that you're going to have.
It's a good time to think about what we say.
Okay. Yeah, it's okay. How did we do that? Okay, the politicians first had heard of us with that memorandum, that was a year after, but our goal was, in fact, to implicate also the elderly, because that's the goal we needed to take. So we put, it was important to put our Retro Council in the spotlight and let senior citizens know that we were there to be the voice in the policy. We designed a logo. This is our logo. We were very creative. And it has a meaning. It's not just a logo like that. As I said, we are the Retro Raad. Raad means council. So we have the two R's with a circle around in two colors, gray and gold. Because we have gray hair, but we have gold advice. Okay. Yeah. Okay.
Let's focus now on some key achievements.
The first thing that I want to present is a project that we have for the digital, we call it Project Digi. It was in fact promoting the digital knowledge of our elderly. It was a program that was launched by the Flemish government and the city of Aalst, and with other organizations, and the Retro Raad, the Retro Council, has taken this up, and we organized different sessions. You had a digital help. I'll give some pictures. The program was Mag ik ook de wereld digitaal verkennen? May I also discover the digital world? That was the campaign. And the idea was that we have a digital help. You had a problem with your computer, with an app or whatever, you can go to 13 contact points and a volunteer will help you out. You have the digital workshops. Some tools are very tricky, you don't know what to do with it, and you could go to the workshop and there it will be explained, very simple, low level, and you can have some hand-ons to try it out, how it works. You can also have followed some lessons, which is in fact a few half days. You follow on themes, like for instance, how can I organize my mobile? How can I organize my computer? How do I work safely on the internet? And last but not least, we have also a Digi Café. It's a socializing. We come together on a cup of tea, no coffee, we drink coffee, and a cookie, and we discuss about digital issues, but it's more a socializing you have, but also we like also some beer. That is a fact. That's for after then. Okay.
So we also organize a retro festival. The new generation of seniors no longer hides behind the snake plants. You know what it is, a snake plant? We know it Sansevieria, you know?
The green
yeah.
leaves, which
yeah.
are very long.
The seniors now, they are assertive, articulated, passionate, and playing a role as pillars of support in social life. It's very important in Aalst. Reason enough to organize a 4-day cultural event in which seniors take center place. So, based on their own interests, they put together a program that stimulates, informs, entertains, and above all, leaves plenty of room for meeting and socializing. So we look at the photos. We see here some impressions what happened during those 4 days. From a breakfast buffet to an information fair to even a chocolate tasting, special for Belgium, the best chocolate in the world. Even the physical activities such as yoga and tai chi was not missing. The dancing afternoon was a very great success and created connection between the different players, the different participants. This year, we also have a festival will take place again from 21 to 24 November with a new program. Breaking the stereotypes of elderly is the headliner this year. I think it's very important. So we organized a fashion show in the main act of the program. 21 seniors will walk the catwalk, wearing clothes from our local thrift store. So the theme is built around sustainability, sorry, it's difficult to pronounce for me, in the fashion world, and makes the link to our other program, Lab. So, but also not forget, we perhaps also do a whiskey tasting.
This year we have included it. Okay. Hij moet verder.
Oh, yeah, okay. So I will talk something about...
I will keep it short, this. As I said before, we'd also do some citizen participation. So we organize gatherings with elders, and we have some discussion about it. So some topics that concern them, that can be mobility, whatever. And that information, the result of that, we bring to the policymakers to say, look, this is what concerns us, but we also provide some solutions on it. So those gatherings is not only to say, I'm going to complain because this or that is not working, but we also ask the elderly, give us solutions, because they experience it, so they know what to do with it. So I think it's very important for that. So these are some impressions, how we do it in groups, and sometimes we work also with young people to have an understanding how they think about some topics, and it's very rewarding because you get better insight and respect between each other. So, because mobility for them is different than mobility for us. Okay, now you can go for your lab.
So now, I explain a little thing about the art project lab. I can tell you that we were inspired by our partners from Lisbon in the KORALE project. So I will explain. Anyone who thinks that a simple piece of fabric is insignificant is mistaken. We have a young artist, Maaike van den Abele, together with 600 participants, young, old, familiar, unfamiliar, neighbors, passing strangers, brought people together to get creative, because that's also a very important point to have a connection with everyone. So during several afternoons, we came together in the renovated studio of the Cultural Center. Painting, sewing, drawing, everything was there, even the coffee and the cake. So I have also a small fabric of my story, myself. So my... Ah ja, ik ben short.
This is her fabric.
Yeah. So my little patch shows the beehive. It's a structure of layers, just like life itself. So you can see different layers in different colors. So something dark, something light, so like our state of mind. So bees have also a lot to tell. There are wild bees, there are worker bees, and there even is a queen bee, each with their own role. So without collaboration, there is no result. There will be no honey. So working together, I will say, is very important. So take care also of our bees and don't forget the elderly. Yeah. But now, last but not least, I have a small request for the partners of KORALE. I also brought a piece of fabric, so with drawing materials. So we like that I draw something of their own, so I can take it back to Aalst, and it shall become also part of the artwork.
Good afternoon, everybody. It's a pleasure to be here and to have the opportunity to share some of our experience from Central Denmark region. My name is Lisa Arndt. I'm a project manager at the Factum Research Center in Central Denmark region. Together with me, my colleague, the Director of Research, Camilla Palmhøj, and a consultant of health from Silkeborg Municipality. We've been working together in a community-based program called More Together, which is a multi-component, multi-large interventions, and we will dive into some highlights of this huge program. We've been in different positions, practice, research, and governance this whole project, which is still going on and will continue for many years. The overall vision of this program is to create structural and sustainable change by mobilizing the local community towards one goal, reducing loneliness. Our ambition is to build the capacity, commitment, and infrastructure that allow communities themselves to take action and sustain it over time. The program has 4 interconnected aims: to develop, implement and evaluate the impact of a comprehensive community-based intervention, and then to examine existing best practice initiatives and scale those that works, and to co-design new solutions with local partners and citizens, and then to expand knowledge of who is most at risk of loneliness and how it is experienced in daily life. Maybe some of you have been with us in a webinar we have held in KORALE, and there you can see more about this last point if you like to see it. I think it's on the website of KORALE. Our framework is inspired by the collective impact framework from Stanford University, which is based on the premise that solving complex issues requires stakeholders to collaborate across sectors in local community. The framework ensures that actors commit to a shared vision, continuous communication to share or to build trust, and a backbone organization to ensure coordination, a shared measurement to evaluate impact and track progress, multi-reinforce activity to coordinate stakeholders' action, and the involvement of people with lived experience. In addition, More Together applies principle from the supersetting approach, means that interventions are developed and anchored across settings in school, housing areas, workplaces, local communities, rather than being a project parallel. A core part of More Together has been capacity building, strengthening the ability of local actors and the whole systematically with loneliness prevention. Rather than creating new structures, we focus on empowering existing ones, associating volunteer groups, frontline staff, and community connectors to integrate social connection in their everyday practice. This has included training sessions, peer learnings, workshop, and mentoring networks that help participatory identifying loneliness and guide people towards meaningful activities. Through these programs, we have built a stronger shared language across sectors, health professionals, social workers, and civil societies actors now talked about loneliness using the same concepts and tools. The capacity building had also been about nurturing or co-creating new initiatives and bringing and adapting international best practice initiative to the local needs. The implementation parts, this includes mapping, coordinating and scaling best practice initiative. A key connecting model is the community navigator model, which is placed in the volunteer center, who helps linking citizens, services and community organization. Then we have been campaigning. We focus on raising public awareness and mobilizing citizens, association and local companies to act together. The research and evaluation has been an integrated part of the whole program and all activities, and the design Camilla will present later on this talk. These areas are iterative and continuously informing and strengthen each other. Yeah, and now I'm
Together reflects what we might call a real-world test of how a complex community-based intervention can take shape. So we began with a comprehensive mapping of existing initiatives addressing loneliness, from counseling and befriending services to drop-in centers and social clubs. And this mapping provided a shared overview of resources across the municipality and helped guide coordination, recruitment, and the scaling of best practices. A cornerstone of the implementation has been the community navigators model, as Lisa also told. These navigators are placed at the volunteer center of Silkeborg, where they guide individuals experiencing loneliness towards suitable activities based on their needs and preferences. They also work across sectors, linking professionals and volunteers and community organizations, effectively bridging the gap between system and community. About campaigning, this has been one of the strongest drivers in More Together. From the beginning, our goal was not only to implement interventions, but to create a shared public awareness that loneliness is a collective concern, something that we can act on together. So through national and local campaigns, seminars and media collaborations, we reached thousands of citizens across different age groups. We've joined the National United Against Loneliness movement, while also developing local campaigns in Silkeborg that highlight positive social norms, showing that seeking connection is a sign of strength and not weakness. The campaigns have worked on several levels. At the individual level, they invite people to take part in community life. At the organizational level, they mobilize local institutions, associations, and companies. And at the political level, they legitimize loneliness as a topic of shared responsibility.
Yes. Loneliness is a real problem, issue from citizens, and it's important to take that outset from the activities. But at the same time, I come from a research organization. I've been involved in more together from the outset. It has been co-designed in a collaboration between researchers and practice, because we really wanted to make sure that what we are doing is based on existing knowledge on how to reduce loneliness, but also respecting that there's a lot we don't know, where we don't have research knowledge. So this is also an opportunity for us as researchers to do research together with practice to really give us a better knowledge on how to address this problem. Since we are moving at a system level here, where we try to engage a whole community and make them work together, we had a lot of issues on how do we really do research on that. What we decided is that at an overall level, we wanted to see if we could really reduce loneliness in the population in Silkeborg, which means that what we started doing was to do a population-based survey where we look into baseline on loneliness, social participation and well-being in the whole municipality. And we have just finished gathering or regathering data to allow us to see if we have really succeeded in reducing loneliness across the municipality as a whole. At the same time, we recognize that the system-wide way of addressing this also includes a lot of activities and specific interventions. So in combination, we have done evaluations of a number of specific activities, looking at both outcome and implementation. That could be activities as mentoring networks, community navigation, befriending services, to gain more insight into specific activities within the system-wide approach. This is a quite unique way of trying to gathering data, and we really hope that we, together with practice, can help develop strategies for addressing loneliness in communities. So the research team works very closely with the local partners, providing feedback during the process and not only when we are done with the research after 5, 6, 7 years, whatever. Research sometimes takes a long time. So if we just look at some of the learnings and challenges that we have had so far, I've only chosen a few of them. More Together has really confirmed that addressing loneliness effectively requires a cross-sector, cross-actor approach where we work together and not only as individual organizations. No single actor can solve this alone. We need to collaborate between governments at different levels, in our case regional, municipal. We need to include civil society, volunteers, health services, and not least the citizens themselves. Their voice in telling us what matters is extremely important. Second, not surprising, we've heard it from the other presentations too, adaptability is extremely important. COVID was one obstacle, but there are obstacles in real life in addressing development, so we have to be flexible and adaptive. Third, of course, you all know that the political and administrative commitment to continue to address loneliness is extremely important. So that's part of the process too, to make sure that politicians and administrative staff are continuously committed. And then also familiar challenges. I'm sure you've all met them. Making sure that loneliness doesn't lose to competing agendas. And also volunteer fatigue, where some organizations that played a central role suddenly lose volunteers and is no longer there. So the sustainability and the foundation for civil society to interact is extremely important. So these challenges have learned us that community-based system support takes time and continuous implementation. It's never a set activity. And finally, perspective and transferability, because our aim is that this is, of course, in Silkeborg, but we also want to make sure that this is scaled up and that lessons is spread to other communities within our region and nationally. Our activities have confirmed that structural prevention is a necessary strategy, and that the program is transferable, but that we also need to make sure that we fit it into local context. And finally, I just want to say that it's been a pleasure being part of the KORALE, because it has inspired us, and it has also reconfirmed that our ambition to build learnings from more together into policy development, both at a regional community but also a national level, is important. So we can continue to demonstrate how loneliness can be tackled. So thank you very much.